not only there's a lot of neuroprotective drugs and other non-pharmacological therapies has been developed, and lots of them are targeted on a single target of the ischemic injury, but there's also lots of non-pharmacological therapies that can target on the multiple targets of the ischemic injuries. And among these therapies, recently very promising and more investigated strategy is remote ischemic conditioning. And this therapy is that can be easily performed that on the bilateral arm or unilateral arms that can for several times of ischemic followed by reperfusion of the blood can generate the protection to the brain. And this therapy has been invested in animal studies, and several clinical trials has provided promising results that the remote ischemic conditioning maybe benefit the patients by improve the cerebral blood flow or reduce the recurrence of ischemic stroke. And in recently, we also performed a meta-analysis of the use of remote ischemic conditioning for patients with ischemic stroke. And in our meta-analysis, we found that for patients with ischemic stroke who were not treated with intravenous thrombolysis or thrombectomy, and if the remote ischemic conditioning performed for 1 week or 2 weeks, and it can benefit the patients by improving the proportion of patients who can achieve the excellent outcome at 90 days, and the excellent outcome was defined as the MR score of 0 to 1. And for the patients who are treated with intravenous thrombolysis and universal thrombectomy, currently there's not enough number of studies to perform the benefits of patient the benefit of remote ischemic conditioning in these part of patients. But we can see that recently, 2 months ago, there's also a clinical trial that performed in China that published in the Europe Heart Journal that the results showed that in patients who are treated with a thrombectomy, that the remote ischemic conditioning that performed within 1 week, within 24 hours for 1 week, and twice delay, that it can improve the functional independence of these part of patients. But the study only include about 500 of patients, and the sample size is relatively small. And now we are also conducting clinical trials that enrolled patients about 2,000, and we will further determine the safety and efficacy of a remote ischemic conditioning for patients who are treated with thrombectomy. And in this study, we also investigated whether 2 weeks or 1 month of remote ischemic conditioning can has similar benefits, or they have different benefits, and to determine the optimal protocol of remote ischemic conditioning. And for patients who are treated with intravenous thrombolysis, and the preliminary studies showed that remote ischemic conditioning can benefit these part of patients by improving the functional independence, but the sample size is relatively small. And as far as I know, there's also several clinical trials that is conducting in the field of remote ischemic conditioning, especially for patients who are treated with thrombectomy, treated with intravenous thrombolysis, and not treated with both of them. And in our group, we also just finished the large clinical trial about we use the remote ischemic conditioning to prevent stroke-associated pneumonia in patients in patients with ischemic stroke. But unfortunately, in this study, we enrolled 1,650 patients. But in this trial, we didn't find the benefits of remote ischemic conditioning in benefit the patient by reduce the incidence of stroke-associated pneumonia. And also there's also some promising, or there's also some disappointing clinical trial results in the field of remote ischemic conditioning for ischemic stroke. But I believe that with more and more studies that conducted in this field, and these trials will finally determine finally the benefits or the non-benefits of remote ischemic conditioning for patients with ischemic stroke. And also there's a lot of trials. I think the most promising therapies, the most promising directions of remote ischemic conditioning in this field is targeted on the patients who are treated with thrombectomy, because from the animal studies we can see that a lot of studies was performed and determined the benefits of remote ischemic conditioning in the mode of ischemia and reperfusion mode. So based on the mode of the preclinical studies, and if we transform from a preclinical study to clinical trials, and the target patients is those who are treated with thrombectomy, especially those who achieved fully recanalization. So maybe our clinical trial that performed ischemic conditioning in patients treated with thrombectomy will reach our interim analysis. Maybe next month we will enroll we will reach our interim enrollment next month, and we hope to present our result in next year's the ESOC conference about the interim analysis of our findings, and the interim analysis will include about 800 patients who are treated with thrombectomy, and we hope our study can provide more solid evidence of remote ischemic conditioning in this field.